Question 1. Governance review demonstrates that the health data analytics team is considering adopting a new statistical software tool for analyzing patient outcomes data. The team is impressed by the tool's user-friendly interface and its perceived ability to generate visualizations quickly. However, the review also highlights a lack of formal assessment regarding the software's compliance with data security standards, its audit trail capabilities for tracking data modifications, and its capacity to ensure the reproducibility of analytical results, all of which are critical for maintaining compliance with U.S. healthcare regulations and organizational data governance policies. Which of the following approaches best addresses this situation? Option A. Prioritize the adoption of the new software due to its user-friendly interface and speed, assuming that any necessary compliance adjustments can be made post-implementation. Option B. Implement the new software immediately to leverage its visualization capabilities for patient outcomes and address any potential compliance issues as they arise during ongoing analysis. Option C. Focus the evaluation primarily on the software's cost-effectiveness and the team's familiarity with its features, as these factors are often the most significant drivers of analytical efficiency. Option D. Conduct a comprehensive evaluation of the statistical software's security features, audit logging capabilities, and validation protocols to ensure alignment with HIPAA requirements and organizational data governance policies before adoption. The correct answer is D. Conduct a comprehensive evaluation of the statistical software's security features, audit logging capabilities, and validation protocol to ensure alignment with HIPAA requirements and organizational data governance policies before adoption. Explanation. Scenario analysis. This scenario presents a common challenge in health data analytics, where the choice of statistical software can have significant implications for data integrity, regulatory compliance, and the reliability of insights. The challenge lies in balancing the perceived efficiency or familiarity of a particular tool with the stringent requirements for data analysis in healthcare, particularly concerning data privacy, security, and the reproducibility of findings. The need for robust validation and adherence to established data governance policies adds layers of complexity. Correct approach analysis. The correct approach emphasizes a systematic evaluation of statistical software tools against established organizational policies and regulatory frameworks. This involves assessing the software's capabilities for data security, audit trails, validation of analytical methods, and its ability to produce reproducible results. Adhering to these criteria ensures that the chosen tool supports compliance with regulations such as HIPAA, Health Insurance Portability and Accountability Act, in the U.S., which mandates the protection of protected health information. 5. It also aligns with best practices for data governance, promoting transparency and accountability in data analysis. This approach prioritizes the integrity and security of health data, which is paramount in the healthcare industry. Incorrect approach is analysis. One incorrect approach focuses solely on the cost-effectiveness of a software tool without adequately considering its suitability for handling sensitive health data or its compliance with relevant regulations. This can lead to the adoption of tools that lack necessary security features, audit capabilities, or validation mechanisms, thereby increasing the risk of data breaches and non-compliance with HIPAA or similar privacy laws. Another incorrect approach prioritizes the familiarity and ease of use of a particular statistical software among the analytics team, overlooking its limitations in terms of data governance, reproducibility, or its ability to meet specific analytical needs for healthcare data. This can result in the use of tools that are not robust enough for complex health data analysis, or that do not provide the necessary controls for data integrity and security, potentially leading to flawed insights and regulatory violations. A third incorrect approach involves implementing a new statistical software tool without a formal validation process, or without ensuring it integrates seamlessly with existing data governance frameworks and security protocols. This can introduce vulnerabilities, compromise data quality, and hinder the ability to demonstrate compliance with regulatory requirements, as the tool's performance and security have not been independently verified within the organizational context. Professional reasoning. Professionals should adopt a decision-making framework that begins with a thorough understanding of the regulatory landscape, e.g., HIPAA in the U.S. This is followed by an assessment of organizational data governance policies, including requirements for data security, privacy, and auditability. The evaluation of statistical software should then be a systematic process, comparing the features and capabilities of each tool against these established requirements. This includes verifying the software's ability to handle sensitive data securely, its support for reproducible research, and its compliance with validation standards. A pilot testing phase and a review by a data governance committee are crucial steps before final adoption to ensure alignment with all mandates and best practices. Question 2. Regulatory review indicates that a health data analyst is tasked with developing a predictive model to identify patients at high risk for a specific chronic condition, utilizing a large dataset of electronic health records. The goal is to integrate this model into a clinical decision support system. The analyst must ensure that the model's development and deployment strictly adhere to U.S. federal regulations governing patient privacy and data security. Considering the potential for re-identification and unauthorized disclosure of protected health information, which approach best balances the analytical objective with regulatory compliance. Option A. Employ a random forest algorithm, ensuring the training data is rigorously de-identified through comprehensive anonymization and aggregation techniques that prevent re-identification, and present model outputs in an aggregated or appropriately masked format. Option B. Implement a random forest algorithm using only minimal de-identification, e.g., removing direct identifiers on the training data, and then generate individual patient-level risk scores for direct clinical use. Option C. Develop a decision tree algorithm, applying moderate anonymization to the training data, and then present the model's predictions as generalized risk categories rather than specific scores for individual patients. Option D. Utilize a single, deep decision tree algorithm trained on raw patient data, as its interpretability allows for direct identification of risk factors and present individual patient risk scores to clinicians. The correct answer is A. Employ a random forest algorithm, ensuring the training data is rigorously de-identified through comprehensive anonymization and aggregation techniques that prevent re-identification, and present model outputs in an aggregated or appropriately masked format. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a health data analyst to balance the need for accurate predictive modeling with strict adherence to patient privacy regulations, specifically the Health Insurance Portability and Accountability Act, HIPAA, in the U.S. The core tension lies in how to best utilize sensitive patient data for clinical decision support, while minimizing the risk of re-identification or unauthorized disclosure. The choice of classification algorithm and its implementation directly impacts both the utility of the model and its compliance with legal and ethical standards. Careful judgment is required to select an approach that is both effective and defensible under regulatory scrutiny. Correct approach analysis. The correct approach involves using a random forest algorithm with appropriate anonymization and aggregation techniques applied to the training data. This represents best professional practice because random forests, by their nature, are ensemble methods that reduce variance and improve generalization compared to single decision trees. More importantly, when combined with robust data anonymization, e.g., removing direct identifiers, aggregating demographic data to broader categories, and ensuring no unique combinations remain, and aggregation, e.g., presenting predictions at a group level rather than for individual patients where feasible. This approach significantly mitigates the risk of re-identification. This aligns with HIPAA privacy rule, which permits the use and disclosure of de-identified health information for research and public health purposes, and its security rule, which mandates safeguards to protect electronic protected health information. The focus on minimizing re-identification risk through data preprocessing and ensemble methods demonstrates a proactive commitment to patient privacy and regulatory compliance. Incorrect approaches analysis. One incorrect approach involves using a single, deep decision tree algorithm directly on raw patient data, without any anonymization or aggregation. This is a significant regulatory and ethical failure, because deep decision trees can create highly specific rules that, when combined with even seemingly innocuous data points, can inadvertently lead to the re-identification of individuals, violating HIPAA privacy protections. The specificity of individual tree path makes them more susceptible to linkage attacks. Another incorrect approach is to use a random forest algorithm, but to apply only minimal anonymization, such as removing only direct identifiers like names and social security numbers, while retaining granular demographic and clinical details. This is also a regulatory failure because HIPAA requires more comprehensive de-identification to prevent re-identification through indirect means. The ensemble nature of random forests does not inherently protect against re-identification if the underlying data is not sufficiently de-identified. A third incorrect approach is to use a decision tree algorithm and present its output as individual patient-level risk scores without any aggregation or further anonymization. This is a direct violation of HIPAA privacy provisions, as it exposes specific risk assessments tied to individual patient data, increasing the likelihood of unauthorized disclosure or misuse. Even if the tree itself is not overly complex, the direct linkage of a risk score to an identifiable patient without appropriate safeguards is problematic. Professional reasoning. Professionals should approach this situation by first understanding the specific regulatory requirements, HIPAA in this case, and the ethical obligations to protect patient privacy. The decision-making process should involve 1. Identifying the objective, to build a predictive model for clinical decision support. 2. Assessing data sensitivity, recognizing that patient health information is protected and requires stringent safeguards. 3. Evaluating algorithmic properties, understanding how different algorithms, decision trees vs. random forests, can impact privacy risks, e.g., specificity of rules, potential for re-identification. 4. Prioritizing privacy-preserving techniques, implementing robust anonymization and aggregation strategies as a foundational step, regardless of the chosen algorithm. 5. Selecting the algorithm that best balances predictive accuracy with privacy, considering ensemble methods like random forests when combined with strong data protection measures. 6. Documenting all steps, maintaining clear records of data handling, anonymization processes, algorithm selection, and justification for compliance. 7. Seeking expert consultation, engaging with legal counsel or privacy officers when in doubt about compliance. Question 3. The assessment process reveals that a healthcare organization is exploring new data standards and interoperability solutions to improve patient care coordination. The analyst must recommend a strategic direction. Which of the following approaches best aligns with the regulatory framework for health data in the United States and promotes effective, secure data exchange? Option A. Prioritize the adoption of data standards and interoperability solutions that are certified by the Office of the National Coordinator for Health Information Technology, ONC, and demonstrably adhere to the HIPAA privacy and security rules for the protection of protected health information. 5. Option B. Select interoperability solutions based primarily on the recommendations of individual healthcare providers, without a formal assessment of their alignment with national standards or federal privacy regulations. Option C. Implement data standards that are widely used in research settings, but have not been formally evaluated for their compliance with HIPAA requirements for the protection of patient privacy and security in clinical practice. Option D. Focus on implementing the most advanced proprietary data formatting technologies available, as these often offer the most comprehensive feature sets for data analysis, regardless of specific regulatory compliance. The correct answer is A. Prioritize the adoption of data standards and interoperability solutions that are certified by the Office of the National Coordinator for Health Information Technology, ONC, and demonstrably adhere to the HIPAA privacy and security rules for the protection of protected health information. 5. Explanation. The assessment process reveals a common challenge in health data analysis, ensuring that data standards and interoperability initiatives are not merely implemented, but are effectively aligned with the specific regulatory landscape governing health data in the United States. This scenario is professionally challenging because the rapid evolution of health IT, coupled with diverse stakeholder needs and varying interpretations of regulations, can lead to misaligned strategies. Careful judgment is required to navigate these complexities and ensure compliance and effective data exchange. The correct approach represents best professional practice because it prioritizes adherence to the Health Insurance Portability and Accountability Act, HIPAA, privacy and security rules, as well as the standards established by the Office of the National Coordinator for Health Information Technology, ONC, for health data interoperability. These regulations and guidelines mandate specific requirements for the protection of protected health information, FI, and the technical standards necessary for seamless and secure data exchange. By focusing on these foundational elements, the analyst ensures that any data standards or interoperability solutions are legally compliant, ethically sound, and technically feasible within the U.S. healthcare ecosystem. This approach fosters trust, protects patient privacy, and enables the efficient and accurate sharing of health information, which are critical for improved patient care and public health initiatives. An incorrect approach that focuses solely on adopting the latest proprietary data formatting technology, without considering HIPAA requirements for data de-identification and security, would be professionally unacceptable. This failure would violate the core tenets of HIPAA, risking breaches of PHI and significant legal penalties. Another incorrect approach, such as prioritizing vendor-specific interoperability solutions that do not adhere to ONC-certified standards, would undermine the goal of widespread interoperability. This would create data silos, hindering the ability to exchange information across different healthcare systems and ultimately compromising patient care coordination. A third incorrect approach, neglecting to establish clear data governance policies that define data ownership, access controls, and audit trails in accordance with HIPAA, would create significant security vulnerabilities and compliance risks. Without such policies, the organization would be unable to demonstrate accountability for data handling, leading to potential regulatory scrutiny and fines. Professionals should employ a decision-making framework that begins with a thorough understanding of the applicable U.S. regulatory environment, including HIPAA and ONC regulations. This should be followed by an assessment of the organization's specific data needs and interoperability goals. The next step involves evaluating potential data standards and interoperability solutions against these regulatory requirements and organizational objectives, prioritizing those that demonstrate clear compliance and promote secure, efficient data exchange. Finally, continuous monitoring and adaptation are crucial to stay abreast of evolving regulations and technological advancements. Question 4. The risk matrix shows the performance of two predictive models for identifying patients at high risk of hospital readmission. Model A has a receiver operating characteristic ROC curve that is consistently above and to the left of Model B's ROC curve, and its area under the curve OC is 0.85, while Model B's AUC is 0.82. However, a deeper dive into Model A's performance reveals that at a specific clinically relevant threshold, its sensitivity is lower than Model B's, even though its overall AUC is higher. Which approach best guides the decision on which model to recommend for implementation, considering both performance metrics and potential clinical impact? Option A. Recommend the model with the highest AUC regardless of the ROC curve's shape or specific threshold performance, as AUC is the most comprehensive measure of predictive accuracy. Option B. Recommend the model that requires the least amount of data to train, as data efficiency is the primary driver of model selection in healthcare analytics. Option C. Recommend Model B because, despite a slightly lower AUC, it demonstrates higher sensitivity at a critical clinical threshold, which is paramount for early intervention in high-risk patients. Option D. Recommend Model A due to its consistently superior ROC curve and higher overall AUC, as these metrics indicate better general discriminative ability. The correct answer is D. Recommend Model A due to its consistently superior ROC curve and higher overall AUC, as these metrics indicate better general discriminative ability. Explanation. This scenario is professionally challenging because it requires a health data analyst to interpret complex model performance metrics, specifically ROC curves and AUC, within the context of regulatory compliance and ethical data handling. The analyst must move beyond simply reporting numbers to understanding the implications of model performance for patient care and data privacy, adhering strictly to U.S. healthcare regulations. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the predictive model's performance across different thresholds, directly informing its clinical utility and potential for bias. Evaluating the ROC curve shape and the AUC value together allows for a nuanced assessment of the model's ability to distinguish between true positives and false positives, which is critical for making informed decisions about its deployment in a healthcare setting. This aligns with the principles of responsible data use and the ethical obligation to ensure that analytical tools do not inadvertently harm patients or violate privacy. Adherence to regulations like HIPAA necessitates that any data used for predictive modeling is handled with care, and the models themselves are validated to ensure they are effective and do not introduce new risks. An incorrect approach that focuses solely on a single point on the ROC curve, without considering the overall curve, or AUC, fails to capture the model's performance across all possible classification thresholds. This can lead to misinterpretations of the model's sensitivity and specificity trade-offs, potentially resulting in the selection of a model that is suboptimal for the intended clinical application. Ethically, this could lead to misdiagnosis or inappropriate treatment decisions. From a regulatory standpoint, using a poorly validated or inadequately understood model could be seen as a failure to exercise due diligence in protecting patient health information and ensuring the quality of care, potentially violating the spirit of HIPAA security and privacy rules. Another incorrect approach that solely relies on the AUC value without examining the ROC curve itself is also problematic. While AUC provides a single, summary measure of performance, it can mask important details about the model's behavior at different operating points. For instance, two models with similar AUCs might have vastly different ROC curves, one performing well at high sensitivity and another at high specificity. Choosing a model based only on AUC without this context could lead to a model that performs poorly in specific clinical scenarios, potentially leading to adverse patient outcomes. This lack of thoroughness in model evaluation could be construed as a failure to meet the standards of care and data integrity expected under U.S. healthcare regulations. A third incorrect approach that prioritizes a model with a high AUC but ignores the potential for bias or fairness issues is ethically and regulatorily unsound. Predictive models in healthcare must not only be accurate but also equitable. If a model performs well on average but exhibits significant disparities in performance across different demographic groups, its use could exacerbate existing health inequities. This is a direct contravention of ethical principles and could also fall afoul of anti-discrimination laws and the broader intent of healthcare regulations to ensure equitable access to quality care. The professional decision-making process for similar situations should involve a multifaceted evaluation of predictive models. This includes 1. Understanding the clinical context and the specific goals of the model. 2. Thoroughly analyzing both the ROC curve and the AUC to assess the model's discriminative ability across various thresholds. 3. Investigating potential biases and fairness issues, particularly concerning protected patient populations. 4. Considering the model's interpretability and the feasibility of its integration into existing clinical workflows. 5. Documenting the evaluation process and the rationale for model selection, ensuring transparency and accountability, and compliance with all relevant U.S. healthcare regulations. Question 5. Benchmark analysis indicates that a health system is evaluating the effectiveness of a new post-discharge care program aimed at reducing patient readmissions. The data analyst has compiled quarterly readmission rates for the past 2 years, both before and after the program's implementation. Which data visualization technique would best communicate the program's impact on readmission trends to a mixed audience of clinicians, administrators, and board members, ensuring clarity and actionable insights? Option A. A word cloud summarizing patient feedback on the post-discharge program. Option B. A series of stacked bar charts, each representing a quarter, with segments showing different reasons for readmission. Option C. A line graph showing quarterly readmission rates over the 2-year period with a clear demarcation indicating the program's start date. Option D. A heat map displaying readmission rates by patient demographic groups across different hospital units. The correct answer is C. A line graph showing quarterly readmission rates over the 2-year period, with a clear demarcation indicating the program's start date. Explanation: this scenario is professionally challenging because it requires a health data analyst to translate complex clinical outcomes into easily understandable visual formats for a diverse audience, including non-clinical stakeholders. The challenge lies in balancing data accuracy and integrity with the need for clarity and impact, ensuring that the visualization effectively communicates the intended message without oversimplification or misrepresentation. Careful judgment is required to select the most appropriate visualization technique that aligns with the audience's understanding and the data's nature, while adhering to regulatory requirements for data privacy and reporting. Correct approach represents best professional practice because it prioritizes clarity, accuracy, and audience comprehension, which are fundamental to effective health data communication. By choosing a visualization that clearly illustrates the trend of patient readmission rates over time, it allows stakeholders to grasp the impact of interventions and identify areas for improvement. This aligns with the ethical obligation to present data truthfully and transparently, enabling informed decision-making. Furthermore, it respects the principles of data governance by ensuring that the visualization accurately reflects the underlying data without distortion, thereby maintaining trust and credibility. An incorrect approach that uses a pie chart to represent patient readmission rates over time would be a regulatory and ethical failure. Pie charts are generally unsuitable for displaying trends or comparing multiple categories over a period, leading to misinterpretation and an inaccurate understanding of the data. This misrepresentation could result in flawed strategic decisions, potentially impacting patient care and resource allocation. Ethically, it violates the principle of data integrity and truthful reporting. Another incorrect approach that employs a 3D scatter plot with numerous overlapping data points for the same readmission data would also be professionally unacceptable. Such a visualization would be overly complex and difficult to interpret, obscuring rather than clarifying the trends. This lack of clarity hinders effective communication and decision-making, failing the professional duty to present data in an accessible manner. It could also be seen as a failure to uphold data usability standards. A third incorrect approach that uses a simple bar chart showing only the total number of readmissions without context of time or patient population would be a significant ethical and potentially regulatory failure. While a bar chart can be effective, omitting crucial context like the time period or the denominator, e.g., total admissions, can lead to misleading conclusions about the severity or improvement of readmission rates. This omission compromises the accuracy and completeness of the data presentation, potentially violating regulations that mandate accurate reporting of health outcomes. The professional decision-making process for similar situations should involve a thorough understanding of the data, the intended audience, and the communication objectives. The analyst should first identify the key message to be conveyed, and then evaluate various visualization techniques based on their suitability for representing that message accurately and clearly. This involves considering the type of data, e.g., temporal, categorical, numerical, the relationships within the data, and the cognitive load on the audience. Adherence to established data visualization, best practices, and relevant regulatory guidelines for health data reporting should be paramount throughout the selection and design process. Question 6. Strategic planning requires a comprehensive understanding of an organization's performance. A health data analyst is tasked with providing insights to inform a new strategic initiative aimed at improving patient outcomes while ensuring financial sustainability. The analyst has access to detailed clinical records, patient registration and scheduling information, and billing and reimbursement data. Which approach best leverages these diverse data types for effective strategic planning? Option A. Prioritize administrative data to optimize patient flow and appointment scheduling, believing that efficient operations are the most significant driver of both clinical quality and financial health. Option B. Focus primarily on financial data to identify areas where cost reductions can be made, assuming that increased profitability will indirectly lead to better patient outcomes and operational efficiency. Option C. Analyze clinical data to identify trends in patient diagnosis and treatment effectiveness, then use administrative data to understand patient demographics and service utilization patterns. And finally, incorporate financial data to assess the cost-effectiveness of different treatment pathways and resource allocation. Option D. Concentrate solely on clinical data to identify the most effective treatments, without considering the operational feasibility or financial implications of implementing these treatments across the organization. The correct answer is C. Analyze clinical data to identify trends in patient diagnosis and treatment effectiveness, then use administrative data to understand patient demographics and service utilization patterns, and finally, incorporate financial data to assess the cost-effectiveness of different treatment pathways and resource allocation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a health data analyst to synthesize information from disparate data sources, clinical, administrative, and financial, to inform strategic decisions. The challenge lies in understanding the nuances of each data type, their interdependencies, and how they collectively paint a picture of organizational performance and patient outcomes. Misinterpreting or inadequately integrating these data types can lead to flawed strategic planning, impacting resource allocation, quality improvement initiatives, and ultimately, patient care. The analyst must navigate potential data silos, inconsistencies, and varying levels of detail across these domains. Correct approach analysis. The correct approach represents best professional practice because it acknowledges the inherent value and distinct contributions of each data type. Clinical data provides insights into patient diagnoses, treatments, and outcomes, forming the core of healthcare delivery. Administrative data offers information on patient demographics, encounters, and service utilization, crucial for understanding patient flow and operational efficiency. Financial data details costs, revenue, and reimbursement, essential for financial sustainability and resource management. By integrating these three types, the analyst can develop a holistic view, enabling data-driven strategic planning that balances clinical quality, operational effectiveness, and financial viability. This comprehensive approach aligns with the ethical imperative to optimize patient care and resource utilization, as often underscored by professional guidelines for health data analysis, which emphasize the need for robust, multifaceted data utilization. Incorrect approaches analysis, focusing solely on clinical data, while vital for patient care, neglects the operational and financial realities that underpin healthcare delivery. This can lead to strategies that are clinically sound but financially unsustainable or operationally infeasible. It represents a failure to consider the broader organizational context and can violate ethical principles of responsible resource management. Prioritizing only administrative data overlooks the direct impact on patient health and clinical effectiveness. Strategies based solely on administrative metrics might improve efficiency and patient flow, but could inadvertently compromise the quality of care or patient outcomes, failing to address the primary mission of healthcare. This approach can also lead to misinterpretations of clinical needs and resource requirements, emphasizing exclusively financial data risks creating strategies that are profitable but detrimental to patient care or operational efficiency. A purely financial lens can lead to cost-cutting measures that negatively impact clinical quality, staff morale, or patient access, violating the ethical obligation to prioritize patient well-being and the principle of providing effective care. Professional reasoning. Professionals should employ a decision-making framework that begins with clearly defining the strategic objective. Next, they must identify all relevant data sources, categorizing them into clinical, administrative, and financial domains. The analyst should then assess the quality, completeness, and accessibility of data within each category. A critical step involves understanding the relationships and potential conflicts between data from different domains. The chosen approach should facilitate the integration of these data types to provide a comprehensive understanding of the situation. Finally, the analyst must communicate their findings and recommendations clearly, highlighting the implications of their integrated data analysis for the strategic plan, ensuring that decisions are informed by a balanced perspective across all critical data dimensions. Question 7. The audit findings indicate that the survival analysis performed to assess the impact of a new treatment protocol on patient recovery time may have misinterpreted the statistical outputs. Specifically, the report presented conclusions based on Cox proportional hazards models without a documented assessment of the proportional hazards assumption, and Kaplan-Meier curves were generated without explicitly addressing the implications of patient censoring. Which of the following approaches best addresses these audit findings in accordance with Certified Health Data Analyst, CHDA, best practices and regulatory expectations for data integrity? Option A. Proceed with the existing interpretation, as the p-values from the Cox model are statistically significant and the Kaplan-Meier curves visually suggest a positive trend, assuming the underlying assumptions were met. Option B. Focus solely on recalculating the median survival times from the Kaplan-Meier curves, as this is the most commonly understood metric for survival analysis, and disregard the proportional hazards assumption for the Cox model, as it is a complex technical detail. Option C. Reevaluate the Cox proportional hazards model by testing the proportional hazards assumption and re-examine the Kaplan-Meier curves to ensure appropriate handling of censored data. Then revise the interpretation and reporting to accurately reflect the validated findings. Option D. Amend the audit report to state that the survival analysis was conducted using standard methods and that any potential misinterpretations are due to the inherent complexity of survival statistics without further investigation or correction. The correct answer is C. Reevaluate the Cox proportional hazards model by testing the proportional hazards assumption and re-examine the Kaplan-Meier curves to ensure appropriate handling of censored data. Then revise the interpretation and reporting to accurately reflect the validated findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the analyst to interpret complex statistical outputs within the strict confines of regulatory compliance and ethical data handling. The audit findings highlight a potential misapplication of survival analysis techniques, which could lead to flawed conclusions about patient outcomes and potentially impact resource allocation or quality improvement initiatives. The pressure to provide actionable insights while adhering to data privacy and accuracy standards necessitates careful judgment. Correct approach analysis. The correct approach involves a thorough review of the Kaplan-Meier curves and Cox proportional hazards model assumptions to ensure their appropriate application and interpretation. This aligns with the Certified Health Data Analyst (CHDA) exam's emphasis on understanding the practical application of analytical methods in healthcare. Best professional practice dictates verifying the validity of the statistical assumptions underlying these models, e.g., proportional hazards for Cox models, independence of censoring for Kaplan-Meier, before drawing conclusions. This ensures the integrity of the analysis and the reliability of the insights derived, which is crucial for evidence-based decision-making in healthcare, and aligns with the ethical obligation to provide accurate and unbiased information. Incorrect approach is analysis. One incorrect approach would be to solely rely on the p-values from the Cox model without assessing the proportional hazards assumption. This is a regulatory and ethical failure because it ignores a fundamental requirement for the valid interpretation of Cox regression results. Violating this assumption can lead to incorrect hazard ratios and misleading conclusions about the impact of covariates on survival, potentially leading to misinformed clinical or operational decisions. Another incorrect approach would be to present Kaplan-Meier curves without considering censoring mechanisms or the potential for competing risks. This is a failure to adhere to best practices in survival analysis and can lead to biased estimates of survival probabilities. Ethically, presenting incomplete or misleading survival data can misrepresent patient outcomes and undermine trust in the analytical process. A third incorrect approach would be to oversimplify the interpretation of survival analysis results by focusing only on the median survival time, without acknowledging the full survival distribution or the confidence intervals. This can lead to a superficial understanding of patient prognosis and may not capture the nuances of risk across different patient subgroups, representing a failure in providing comprehensive and accurate analytical reporting. Professional reasoning. Professionals should employ a structured decision-making framework when faced with such audit findings. This involves 1. Understanding the audit scope. Clearly define what aspects of the survival analysis are being questioned. 2. Data and methodology review. Re-examine the data used, the statistical methods applied, and the underlying assumptions. 3. Regulatory compliance check. Ensure all analytical processes and reporting adhere to relevant healthcare data regulations and CHDA ethical guidelines. 4. Peer review/consultation. If necessary, consult with senior analysts or statisticians to validate findings and interpretations. 5. Clear and accurate reporting. Communicate findings transparently, highlighting any limitations or assumptions made. Question 8. Benchmark analysis indicates that a clinical team requires immediate access to a large dataset of patient treatment histories to identify trends that could improve a critical patient care protocol. The Certified Health Data Analyst, CHDA, is tasked with facilitating this access. Which of the following approaches best aligns with robust data governance and regulatory compliance for handling protected health information? 5. Option A. Initiate a formal data access request through the established organizational channels, ensuring the request clearly outlines the purpose of data use, the specific data elements required, and the intended duration of access, while adhering to all organizational data governance policies and privacy regulations. Option B. Proceed with de-identifying the data using a commonly understood method without formal verification or documentation of the de-identification process, and then provide the dataset to the clinical team. Option C. Request the IT department to extract the data and provide it to the clinical team, relying on informal communication and assuming IT has the authority to grant such access without a formal documented request. Option D. Directly access the required data from the clinical database, assuming the clinical team's need justifies bypassing standard procedures, and provide the data to them with a verbal assurance of confidentiality. The correct answer is A. Initiate a formal data access request through the established organizational channels, ensuring the request clearly outlines the purpose of data use, the specific data elements required, and the intended duration of access, while adhering to all organizational data governance policies and privacy regulations. Explanation: this scenario is professionally challenging because it requires balancing the immediate need for data access to improve patient care with the stringent requirements of data governance and privacy regulations. The Certified Health Data Analyst, CHDA, must navigate complex legal frameworks, ethical considerations, and organizational policies to ensure data is used responsibly and securely. Careful judgment is required to avoid breaches that could lead to significant legal penalties, reputational damage, and erosion of patient trust. The correct approach represents best professional practice because it prioritizes a systematic, compliant, and risk-aware methodology. This involves adhering to established data governance policies, which are designed to ensure data quality, integrity, security, and privacy. By initiating a formal data request process, the analyst ensures that the use of patient data is documented, approved by appropriate stakeholders, e.g., Data Governance Committee, Privacy Officer, and aligns with the organization's policies and relevant regulations. This proactive approach minimizes the risk of unauthorized access or misuse of protected health information, thereby upholding ethical standards and regulatory compliance. An incorrect approach that involves bypassing established protocols for expediency poses significant regulatory and ethical failures. Specifically, directly accessing or sharing PHI without proper authorization or a documented approved purpose violates the Health Insurance Portability and Accountability Act, HIPAA, privacy rule. This rule mandates safeguards for PHI and restricts its use and disclosure. Such an action could result in substantial fines, corrective action plans, and potential criminal penalties for both the individual and the organization. Ethically, it represents a breach of patient trust and a failure to uphold the principle of patient confidentiality. Another incorrect approach, such as relying solely on informal verbal agreements with IT or other departments, also fails to meet regulatory and ethical standards. Seemingly efficient, it lacks the necessary documentation and oversight required by data governance frameworks and HIPAA. Informal agreements do not constitute a formal risk assessment or a documented basis for data access, leaving the organization vulnerable to compliance issues if an audit occurs. It also fails to ensure that all necessary privacy and security controls are in place for the specific data being accessed. A third incorrect approach, which involves assuming data is de-identified without proper verification, is also a critical failure. While de-identified data has fewer privacy restrictions, the process of de-identification must meet specific standards, e.g., HIPAA safe harbor or expert determination methods. Without this rigorous verification, the data may still contain identifiable information, and its subsequent use or disclosure could inadvertently lead to a breach of PHI, incurring the same regulatory and ethical consequences as direct unauthorized access. The professional reasoning process for similar situations should involve a clear understanding of the organization's data governance policies and the applicable regulatory landscape. When faced with a need for data access, the professional should first consult internal policies and procedures. If a formal request process exists, it should be followed meticulously. If there is ambiguity regarding data classification, e.g., de-identified status, or the appropriate use of data, seeking guidance from the Data Governance Committee, Privacy Officer, or legal counsel is essential. Prioritizing compliance and ethical considerations over immediate expediency is paramount to safeguarding patient information and maintaining professional integrity. Question 9. System analysis indicates that a regional health system is experiencing increased wait times for specialist appointments and a perceived decrease in the availability of certain diagnostic services. As a certified health data analyst, You are tasked with identifying process optimization opportunities related to the supply and demand of these services. Which of the following approaches would best leverage health economics principles and data analysis to address this challenge, while adhering to U.S. healthcare regulations? Option A. Advocate for the immediate expansion of all diagnostic service lines without a thorough analysis of current utilization rates or patient need based on general market trends. Option B. Analyze patient demographic data, service utilization patterns, provider scheduling efficiency, and referral rates to identify specific areas where demand exceeds supply or where supply is underutilized, and recommend adjustments to resource allocation and scheduling based on these findings. Option C. Focus solely on increasing the number of specialist physicians hired without analyzing existing physician productivity or patient referral patterns. Option D. Propose a significant reduction in the number of available appointment slots for all specialist services to streamline administrative processes and lower operational costs. The correct answer is B. Analyze patient demographic data, service utilization patterns, provider scheduling efficiency, and referral rates to identify specific areas where demand exceeds supply or where supply is underutilized, and recommend adjustments to resource allocation and scheduling based on these findings. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare analytics where understanding the interplay of economic principles, specifically supply and demand, is crucial for optimizing resource allocation and service delivery. The challenge lies in translating theoretical economic concepts into actionable insights for improving operational efficiency and patient access, while adhering to the regulatory landscape governing health data and services. The analyst must consider how external factors influence both the availability of healthcare services, supply, and the need or desire for those services, demand, within a specific regulatory context. Correct approach analysis. The correct approach focuses on leveraging health data to identify and quantify the factors influencing both supply and demand for specific healthcare services. By analyzing patient demographics, service utilization patterns, provider availability, and referral trends, the analyst can build a data-driven understanding of market dynamics. This allows for informed recommendations on process optimization, such as adjusting staffing levels, optimizing appointment scheduling, or identifying opportunities for service expansion or consolidation, all within the bounds of regulations like HIPAA, Health Insurance Portability and Accountability Act, which govern the use and disclosure of protected health information. This approach directly addresses the core of process optimization by using economic principles informed by data to improve efficiency and access. Incorrect approaches analysis. One incorrect approach would be to focus solely on reducing costs without considering the impact on service availability or patient access. This could lead to a decrease in supply, potentially creating shortages and negatively impacting patient care, which would be a failure to meet the implicit ethical and regulatory obligations to provide adequate care. Another incorrect approach would be to ignore the demand side entirely and only focus on increasing the supply of services without understanding actual patient needs or market demand. This could lead to overcapacity, wasted resources, and inefficient allocation, potentially violating principles of fiscal responsibility and efficient healthcare delivery. Third incorrect approach would be to make recommendations based on anecdotal evidence or personal opinions rather than robust data analysis. This lacks the rigor required for evidence-based decision-making in healthcare and could lead to suboptimal outcomes, failing to meet professional standards of practice, and potentially leading to non-compliance with data-driven performance metrics mandated by regulatory bodies. Professional reasoning. Professionals should adopt a data-driven, holistic approach that considers both economic principles and regulatory compliance. This involves 1. Defining the problem clearly, focusing on specific healthcare services or operational areas. 2. Identifying relevant data sources, ensuring they are collected and used in compliance with privacy regulations. 3. Applying economic principles, supply and demand, to analyze the data, looking for trends, bottlenecks, and opportunities. 4. Developing actionable recommendations that balance efficiency, access, and quality of care. 5. Evaluating the potential impact of recommendations, considering both economic and patient outcomes. 6. Presenting findings and recommendations clearly and concisely to stakeholders, supported by data and adhering to ethical guidelines. Question 10. Market research demonstrates that healthcare organizations are increasingly relying on data dashboard to monitor key performance indicators and clinical outcomes. A health data analyst is tasked with creating a new dashboard for a team of clinicians to track patient readmission rates. The analyst has access to a comprehensive dataset that includes detailed patient demographics, treatment histories, and discharge summaries. Considering the regulatory framework for health data in the United States, which approach to dashboard creation best aligns with professional best practices and legal requirements. Option A. Design the dashboard to display aggregated readmission rates by diagnosis code and treatment modality, ensuring all patient-identifiable information is removed or sufficiently de-identified in accordance with HIPAA guidelines, and focus on clear, actionable visualizations that highlight trends and potential areas for intervention. Option B. Build a dashboard that focuses on displaying the raw, unaggregated patient-level data for readmissions, allowing clinicians to manually sift through individual patient records to identify patterns, without implementing specific de-identification measures beyond basic anonymization. Option C. Develop a visually striking dashboard with a wide array of charts and graphs showcasing all available data points, prioritizing aesthetic appeal and a comprehensive overview, even if some data is not directly related to readmission rates. Option D. Create a dashboard that presents the most recent readmission data for every patient, including their full medical history and personal identifiers, to provide the clinical team with complete context for immediate review. Correct answer is A. Design the dashboard to display aggregated readmission rates by diagnosis code and treatment modality, ensuring all patient-identifiable information is removed or sufficiently de-identified in accordance with HIPAA guidelines, and focus on clear, actionable visualizations that highlight trends and potential areas for intervention. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for actionable insights with the long-term implications of data visualization design and adherence to regulatory standards for health data. The analyst must consider not only what data to present, but how to present it in a way that is compliant, understandable, and ethically sound, especially when dealing with sensitive patient information. Careful judgment is required to ensure the dashboard serves its intended purpose without compromising patient privacy or data integrity. The correct approach represents best professional practice because it prioritizes the foundational principles of health data analysis and dashboard creation. Understanding the audience and purpose, ensuring data accuracy and relevance, and designing for clarity and actionability. By focusing on the specific needs of the clinical team and aligning with the Health Insurance Portability and Accountability Act, HIPAA, regulations regarding the use and disclosure of protected health information. 5. This approach ensures the dashboard is both effective and compliant. It emphasizes a systematic, user-centric, and legally sound methodology, which is crucial for maintaining trust and operational efficiency in healthcare settings. An incorrect approach that focuses solely on presenting the most recent data without considering its context or the audience's needs fails to meet the core requirements of effective dashboard design. This can lead to misinterpretations and poor decision-making, undermining the value of the data. Furthermore, if this approach involves displaying granular patient-level data without proper de-identification or access controls, it constitutes a direct violation of HIPAA privacy rule, risking significant penalties and reputational damage. Another incorrect approach that prioritizes aesthetic appeal over functional clarity and regulatory compliance is also professionally unacceptable. While visually appealing dashboards can be engaging, if they obscure critical information, are difficult to navigate, or fail to adhere to data privacy standards, they are detrimental. This can lead to missed insights and potential breaches of confidentiality, as the focus shifts from data utility and security to superficial design elements. A third incorrect approach that involves creating a dashboard with a broad range of metrics without clear objectives or user input neglects the fundamental purpose of data visualization. This data dump approach can overwhelm users, making it difficult to identify meaningful trends or make informed decisions. From a regulatory standpoint, if this broad range of data includes PHI that is not necessary for the stated or implied purpose, it could be considered an overcollection or improper use of sensitive information, potentially violating HIPAA minimum necessary standard. The professional reasoning framework for similar situations should involve a structured, iterative process. 1. Define the objective. Clearly understand the purpose of the dashboard and the specific questions it aims to answer. 2. Identify the audience. Determine who will use the dashboard and what their data literacy and needs are. 3. Data selection and validation. Choose relevant, accurate, and reliable data sources, ensuring data integrity. 4. Regulatory compliance check. Thoroughly review all applicable regulations, e.g., HIPAA in the U.S., to ensure data privacy, security, and appropriate use. This includes de-identification strategies where necessary. 5. Design for clarity and actionability. Create visualizations that are easy to understand, highlight key insights, and facilitate decision-making. 6. User feedback and iteration. Solicit feedback from intended users and refine the dashboard based on their input and evolving needs. 7. Ongoing monitoring and maintenance. Regularly review and update the dashboard to ensure continued accuracy, relevance, and compliance. Question 11. The assessment process reveals that a health data analyst is tasked with segmenting a large patient population based on their electronic health record, AIR data, to identify distinct care pathways. The analyst is considering using clustering techniques, but is unsure of the best approach. Which of the following evaluation strategies best aligns with professional best practices for ensuring the validity and utility of the resulting patient segments? Option A. Apply a single, commonly used clustering technique without investigating its assumptions or comparing its performance against alternative methods for the specific dataset. Option B. Conduct an initial exploratory data analysis to understand data characteristics, followed by an evaluation of cluster interpretability, distinctiveness, and stability using multiple validation metrics. Option C. Prioritize the clustering technique that offers the fastest computation time, as efficiency is paramount in handling large datasets. Option D. Select a clustering algorithm and immediately proceed to define a predetermined number of clusters without further validation of their distinctiveness or stability. The correct answer is C. Prioritize the clustering technique that offers the fastest computation time, as efficiency is paramount in handling large datasets. Explanation. The assessment process reveals a common challenge in health data analysis, selecting the most appropriate clustering technique for patient segmentation without a clear understanding of the underlying data distribution or the desired interpretability of the clusters. This scenario is professionally challenging because the choice of clustering algorithm directly impacts the validity and utility of the insights derived, which in turn can influence clinical decision-making, resource allocation, and quality improvement initiatives. Misapplication of these techniques can lead to flawed conclusions, wasted resources, and potentially adverse patient outcomes, all while risking noncompliance with data privacy and integrity regulations. The correct approach, which involves an initial exploratory data analysis (EDA) to understand data characteristics and a subsequent evaluation of cluster interpretability and stability, represents best professional practice. This aligns with the principles of responsible data stewardship and the ethical obligation to ensure that analytical outputs are robust and meaningful. Specifically, understanding the data's dimensionality, variance, and potential for distinct groupings informs the suitability of algorithms like k-means, which assume spherical clusters, versus hierarchical clustering, which can reveal nested structures. Evaluating interpretability ensures that the identified clusters are clinically relevant and actionable, a key requirement for health data analysis. Stability assessment confirms that the clustering results are not overly sensitive to minor data variation, enhancing confidence in the findings. This methodical approach minimizes the risk of drawing erroneous conclusions and ensures that the analytical process adheres to the spirit of data-driven decision-making, implicitly supporting regulatory requirements for accurate and reliable health information. An incorrect approach that prioritizes computational efficiency over interpretability is professionally unacceptable. While speed is a consideration, it should not supersede the need for meaningful and actionable insights in healthcare. This failure can lead to the generation of clusters that are statistically identifiable but clinically irrelevant, thus failing to support effective patient care or operational improvements. Such a disregard for interpretability can be seen as a breach of professional duty to provide accurate and useful analysis, potentially contravening guidelines that emphasize the practical application of data insights. Another incorrect approach that focuses solely on achieving a specific number of clusters without validating their distinctiveness or stability is also professionally flawed. This can result in artificial segmentation that does not reflect genuine patient subgroups, leading to misdirected interventions or a misunderstanding of population health trends. This approach risks generating misleading reports and can undermine the credibility of health data analysis, potentially leading to noncompliance with regulations that mandate accurate reporting and evidence-based practices. A further incorrect approach that blindly applies a single clustering technique without considering alternatives or validating its suitability for the specific dataset is professionally unsound. Different datasets have different characteristics, and a technique that performs well on one may be entirely inappropriate for another. This lack of critical evaluation can lead to suboptimal or incorrect clustering, resulting in flawed insights and potentially impacting patient care or operational efficiency. This demonstrates a failure to exercise due diligence in the analytical process, which is a cornerstone of professional conduct in health data analysis. The professional decision-making process for similar situations should involve a structured, iterative approach. First, thoroughly understand the analytical objective and the desired outcome. Second, conduct comprehensive EDA to characterize the data, including its distribution, dimensionality, and potential for meaningful segmentation. Third, consider multiple clustering techniques, evaluating their assumptions and suitability for the data and objective. Fourth, rigorously assess the quality of the resulting clusters, focusing on interpretability, distinctiveness, and stability. Finally, document the entire process, including the rationale for technique selection and validation methods, to ensure transparency and reproducibility, thereby upholding professional standards and regulatory compliance. Question 12. System analysis indicates a statistically significant difference in the average length of stay for patients admitted with a specific diagnosis across two different hospital units, identified through hypothesis testing. The p-value is below the predetermined alpha level. As a certified health data analyst, what is the most appropriate next step to ensure patient safety and regulatory compliance? Option A. Conclude that the statistical difference is likely due to random variation and does not warrant further investigation, as the p-value is only marginally significant. Option B. Share the statistical finding with the IT department to check for any data entry errors that might have influenced the length of stay calculation. Option C. Immediately report the statistical finding to senior management and recommend a review of staffing levels in the unit with the longer average length of stay. Option D. Initiate a detailed investigation into the clinical pathways, patient demographics, and treatment protocols for this diagnosis in both units to understand the drivers of the observed difference and assess any potential impact on patient outcomes or data integrity. The correct answer is D. Initiate a detailed investigation into the clinical pathways, patient demographics, and treatment protocols for this diagnosis in both units to understand the drivers of the observed difference and assess any potential impact on patient outcomes or data integrity. Explanation. This scenario is professionally challenging because it requires a health data analyst to interpret statistical findings in the context of potential patient harm and regulatory compliance, rather than simply reporting raw numbers. The analyst must balance the statistical significance of a finding with its practical implications for patient care and data privacy. The correct approach represents best professional practice because it prioritizes patient safety and adherence to regulatory frameworks, such as HIPAA in the U.S. By conducting a thorough risk assessment, the analyst ensures that any identified anomalies are investigated to understand their root cause and potential impact on patient outcomes or data integrity. This proactive stance aligns with the ethical obligation to protect patient health information and prevent adverse events. It also demonstrates a commitment to data-driven decision-making that supports quality improvement initiatives. An incorrect approach that focuses solely on statistical significance without considering clinical relevance or potential patient harm is ethically problematic. It risks overlooking critical issues that could lead to patient endangerment or misdiagnosis. From a regulatory standpoint, failing to investigate and address potential data integrity issues that could impact patient care could be seen as a violation of data stewardship responsibilities. Another incorrect approach that involves immediately escalating a statistically significant finding without any preliminary investigation or contextualization is inefficient and can lead to unnecessary alarm or resource misallocation. While promptness is important, a measured, analytical approach is crucial to ensure that interventions are targeted and effective. This approach fails to demonstrate due diligence in understanding the nature and scope of the statistical anomaly. A further incorrect approach that involves disregarding a statistically significant finding due to its perceived low probability of impacting patient care without a formal risk assessment or consultation is a significant ethical and professional lapse. This demonstrates a failure to apply sound statistical reasoning to real-world health scenarios and could result in missed opportunities for critical intervention or system improvement. It also bypasses established protocols for data analysis and reporting, potentially violating internal policies and external regulations designed to ensure data quality and patient safety. Professionals should employ a decision-making framework that begins with understanding the statistical output, then contextualizing it within the clinical and operational environment. This involves asking, what is the potential impact of this finding on patient care, data privacy, or operational efficiency? What are the relevant regulatory requirements? What is the most prudent course of action to mitigate risks and ensure data integrity? This framework emphasizes a systematic, risk-based approach to data analysis and interpretation. Question 13. The audit findings indicate that the predictive model used for patient risk stratification has demonstrated high accuracy in identifying individuals likely to require intensive care services. However, the audit also flagged potential concerns regarding the model's fairness across different demographic groups and the specific methods used for data de-identification prior to model training. Which of the following approaches best addresses these audit findings and aligns with best practices for predictive modeling in healthcare? Option A. Conduct a comprehensive bias assessment of the model's predictions across all relevant demographic subgroups and independently validate the effectiveness of the de-identification methodology against established privacy standards, ensuring all data handling adheres to HIPAA regulations. Option B. Prioritize the use of publicly available, aggregated datasets for future model development to completely avoid any potential privacy issues, even if it means sacrificing the specificity of the current patient population. Option C. Proceed with deploying the model as is, assuming that high predictive accuracy inherently mitigates any potential fairness or privacy concerns, and that the de-identification methods used are sufficient. Option D. Focus solely on further refining the model's predictive accuracy by exploring more complex algorithms, as high accuracy is the primary indicator of a successful risk stratification tool. The correct answer is A. Conduct a comprehensive bias assessment of the model's predictions across all relevant demographic subgroups and independently validate the effectiveness of the de-identification methodology against established privacy standards, ensuring all data handling adheres to HIPAA regulations. Explanation. This scenario is professionally challenging because it requires balancing the ethical imperative of patient privacy with the operational need for effective risk stratification using predictive models. The Certified Health Data Analyst, CHDA, must ensure that the methods employed for risk stratification are not only accurate but also compliant with all relevant regulations, particularly concerning the use and disclosure of protected health information. 5. The core challenge lies in identifying high-risk patient populations for targeted interventions without compromising patient confidentiality or introducing bias into the models. Correct approach represents best professional practice because it prioritizes a multifaceted evaluation of predictive models, encompassing both their statistical validity and their ethical and regulatory compliance. This includes rigorous validation of model performance, assessment for bias, and a thorough review of data governance and privacy controls. By focusing on these aspects, the CHDA ensures that the risk stratification process is robust, equitable, and adheres to the Health Insurance Portability and Accountability Act, HIPAA, security and privacy rules, which govern the use and disclosure of PHI. This approach aligns with the ethical principles of beneficence, acting in the patient's best interest through effective intervention and non-maleficence, avoiding harm through biased or privacy-violating practices. An incorrect approach that focuses solely on predictive accuracy without considering bias or privacy would be professionally unacceptable. This failure would violate HIPAA privacy rule by potentially leading to inappropriate use or disclosure of PHI if the model's outputs are not handled with appropriate safeguards. Furthermore, it could lead to discriminatory practices if the model exhibits bias against certain demographic groups, violating ethical principles of justice and equity. Another incorrect approach that relies on de-identified data without a clear understanding of re-identification risks or without appropriate data use agreements would also be a regulatory failure. While de-identification is a strategy to protect privacy, it is not foolproof, and the methods used must meet HIPAA standards. Failing to ensure the robustness of de-identification or to establish proper data governance for its use can still lead to privacy breaches. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements, e.g., HIPAA in the U.S. context for CHDA. This is followed by defining the objectives of the predictive model and the acceptable thresholds for performance and bias. A critical step involves assessing the data sources and the methods for data handling, including de-identification and access controls. Finally, continuous monitoring and re-evaluation of the model's performance and its impact on patient populations are essential to ensure ongoing compliance and ethical practice. Question 14. Compliance review shows that a health system is analyzing patient adherence to medication regimen for a chronic condition. The analytics team is considering using only the claims data to assess prescription fill rates, which approach best aligns with best practices for data utilization and regulatory compliance in the U.S. healthcare context. Option A. Merging claims data with publicly available demographic data to infer adherence patterns, without specific patient consent for this secondary use. Option B. Supplementing claims data with EHR data that includes physician notes on patient-reported adherence and medication reconciliation to provide a more comprehensive clinical picture, while ensuring all PHI is handled according to HIPAA. Option C. Relying solely on claims data as it is readily available and provides a clear record of prescription fills, assuming this is sufficient for understanding adherence. Option D. Utilizing data from patient registries that focus on the specific chronic condition, even if this data is less frequently updated than claims data, without cross-referencing with EHRs for clinical context. The correct answer is B. Supplementing claims data with EHR data that includes physician notes on patient-reported adherence and medication reconciliation to provide a more comprehensive clinical picture, while ensuring all PHI is handled according to HIPAA. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare analytics, ensuring the integrity and appropriate use of data from disparate sources like electronic health records (EHR), claims data, and patient registries. The professional challenge lies in balancing the need for comprehensive data analysis to improve patient care and operational efficiency with the stringent requirements for data privacy, security, and accuracy mandated by regulations. Misinterpreting or misapplying data from these sources can lead to flawed insights, incorrect clinical decisions, and significant regulatory penalties. Careful judgment is required to select the most appropriate data source for a given analytical objective, considering the inherent strengths and limitations of each. Correct approach analysis. The correct approach involves a thorough understanding of the specific analytical objective, and then selecting the data source that best aligns with that objective, while adhering to all relevant privacy and security regulations. For instance, if the objective is to understand the clinical progression of a specific disease, EHR data, which contains detailed clinical notes, lab results, and physician observations, would be the most appropriate primary source. However, its use must be governed by HIPAA Health Insurance Portability and Accountability Act regulations, particularly regarding protected health information (FI). Claims data, while useful for understanding utilization patterns and costs, is less granular clinically. Registries, often curated for specific conditions or populations, offer high-quality, standardized data for research and quality improvement, but may have limited scope. Best professional practice dictates a data-driven decision-making process that prioritizes data quality, relevance, and regulatory compliance for the intended use. Incorrect approaches analysis. One incorrect approach is to solely rely on claims data for all analytical needs, assuming it provides a complete picture of patient care. This fails to acknowledge the clinical depth and detail available in EHRs, leading to incomplete or inaccurate analyses of patient outcomes and treatment effectiveness. Ethically and regulatorily, this approach might also inadvertently lead to misinterpretations that could impact patient care if clinical nuances are missed. Another incorrect approach is to indiscriminately combine data from all sources without proper validation and de-identification procedures. This poses significant risks under HIPAA, as it increases the likelihood of re-identification of individuals and unauthorized disclosure of PHI. Furthermore, combining disparate data formats and terminologies without robust data governance can lead to data integrity issues and unreliable analytical results. A third incorrect approach is to prioritize the most readily available data source, regardless of its suitability for the analytical question. This bypasses the critical step of evaluating data quality and relevance, potentially leading to biased or misleading conclusions. Regulatorily, using data that is not fit for purpose could be seen as a failure of due diligence in data management and analysis. Professional reasoning. Professionals should adopt a systematic approach. 1. Clearly define the analytical objective. 2. Identify potential data sources, claims, registries, etc. 3. Evaluate the strengths, limitations, and data quality of each source relative to the objective. 4. Assess the regulatory and ethical implications of using each source, paying close attention to privacy, e.g., HIPAA in the U.S. and security requirements. 5. Select the most appropriate data sources that meet the analytical needs while ensuring compliance. 6. Implement robust data governance, validation, and de-identification processes as necessary. 7. Document the data selection and processing rationale thoroughly. Question 15. Stakeholder feedback indicates a growing concern among hospital administrators regarding patient readmission rates within 30 days of discharge. They require an analytical approach that can identify the key factors contributing to these readmissions and inform targeted intervention strategies. Which of the following analytical approaches would best address this need, considering the nature of the outcome and the desire for a comprehensive understanding of contributing factors? Option A. Conducting simple linear regression to predict the number of readmissions based on average patient length of stay. Option B. Performing separate univariate logistic regressions for each potential predictor of readmission without considering their interactions. Option C. Calculating Pearson correlation coefficients between individual patient demographic variables and the occurrence of readmission. Option D. Employing multivariate logistic regression to model the probability of readmission based on a range of patient characteristics, comorbidities, and treatment details. The correct answer is D. Employing multivariate logistic regression to model the probability of readmission based on a range of patient characteristics, comorbidities, and treatment details. Explanation. This scenario presents a common challenge in health data analytics, translating complex statistical findings into actionable insights for diverse stakeholders, while adhering to strict regulatory requirements for data privacy and reporting. The professional challenge lies in selecting the most appropriate regression technique to address the stakeholders' concerns about patient readmission rates, ensuring the analysis is both statistically sound and interpretable, and that the findings are communicated in a manner that respects patient confidentiality and complies with relevant regulations. The correct approach involves using multivariate logistic regression. This is best professional practice because it allows for the examination of the relationship between multiple independent variables, e.g., patient demographics, comorbidities, treatment protocols, and a binary-dependent variable readmission or no readmission. Logistic regression is specifically designed for binary outcomes, making it statistically appropriate. Furthermore, by including multiple predictors, it provides a more nuanced understanding of the factors influencing readmission, moving beyond simple correlations to identify significant drivers. This approach aligns with regulatory frameworks that emphasize evidence-based decision-making and the responsible use of health data to improve patient care and outcomes without compromising privacy. The output of logistic regression, such as odds ratios, can be explained to stakeholders in a way that highlights risk factors and potential areas for intervention, supporting data-driven quality improvement initiatives. An incorrect approach would be to solely use simple linear regression to predict readmission rates. This is professionally unacceptable because linear regression assumes a continuous dependent variable, whereas readmission is a binary outcome, yes/no. Applying linear regression to binary data can lead to misleading results, including predicted probabilities outside the 0-1 range and an incorrect interpretation of the relationships between variables. This misapplication of statistical methods could lead to flawed conclusions and ineffective interventions, potentially violating ethical obligations to provide accurate and reliable data analysis. Another incorrect approach would be to perform univariate logistic regression for each potential predictor individually without considering their interrelationships. While univariate logistic regression is statistically valid for examining the relationship between a single predictor and the outcome, it fails to account for confounding variables. This can lead to an incomplete or even erroneous understanding of the true drivers of readmission. For example, a factor might appear significant in a univariate analysis, but its effect could be entirely explained by another, more influential variable. This lack of comprehensive analysis can result in misdirected resources and interventions, and a failure to meet the professional standard of providing the most accurate and complete picture possible from the data. It also risks overstating the importance of certain factors, potentially leading to misinterpretations by stakeholders. A final incorrect approach would be to present raw correlation coefficients between various patient characteristics and readmission events without employing any regression modeling. Correlation measures the strength and direction of a linear relationship between two variables, but does not establish causality or control for other factors. Presenting raw correlations as explanatory factors for readmission would be statistically unsound and professionally negligent. It fails to address the complexity of health outcomes, which are influenced by a multitude of interacting factors. This approach would not provide the depth of insight required for effective quality improvement, and could lead stakeholders to draw incorrect conclusions about the causes of readmission, potentially leading to the implementation of ineffective or even harmful strategies. It also fails to meet the expectation of providing robust, statistically validated insights derived from the data. The professional decision-making process for similar situations should involve a thorough understanding of the research question and the nature of the data. This includes identifying the type of dependent variable, continuous, binary, categorical, and the number of independent variables to be considered. Consulting with subject matter experts and understanding the specific regulatory context are crucial. The analyst must then select the statistical method that is most appropriate for the data and the research question, ensuring it can address the stakeholders' needs while adhering to ethical and regulatory standards. Finally, the results must be interpreted and communicated clearly and accurately, highlighting limitations and potential implications for action. Question 16. Governance review demonstrates that the health system is exploring the use of advanced data mining and predictive analytics to identify patients at high risk for hospital readmission. The data analyst is tasked with developing models using historical patient data. What is the most appropriate approach to ensure compliance with federal regulations and ethical data handling practices? Option A. Focus on anonymizing the data by removing obvious patient identifiers, then proceed with model development, as this is sufficient to protect patient privacy under federal guidelines. Option B. Immediately begin applying predictive modeling algorithms to the complete historical patient dataset to identify readmission risks, assuming that the insights gained will outweigh any potential privacy concerns. Option C. Proceed with data mining and predictive analytics using the raw patient data, relying on internal IT security measures to prevent unauthorized access, without specific de-identification or a formal data governance policy. Option D. Prioritize de-identifying patient data according to HIPAA standards, establishing a comprehensive data governance framework with clear data use agreements, and conducting thorough risk assessments before and during the development of predictive models. The correct answer is D. Prioritize de-identifying patient data according to HIPAA standards, establishing a comprehensive data governance framework with clear data use agreements, and conducting thorough risk assessments before and during the development of predictive models. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the potential benefits of advanced data analytics for patient care with the stringent requirements of HIPAA, Health Insurance Portability and Accountability Act, regarding protected health information, FI. The CHDA professional must navigate the complexities of de-identification, data use agreements, and the ethical implications of using patient data for predictive modeling, all while ensuring compliance with federal regulations. The risk of inadvertent re-identification or unauthorized disclosure of PHI is a significant concern. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes de-identification and secure data handling. This aligns with HIPAA privacy rule, which permits the use and disclosure of de-identified health information for research and other purposes, provided specific de-identification standards are met. Establishing a robust data governance framework, including clear data use agreements and access controls, is crucial for maintaining data integrity and patient privacy. Implementing a phased approach to predictive analytics, starting with de-identified data and progressively incorporating more sensitive data only after rigorous risk assessments and appropriate safeguards are in place, represents best professional practice. This demonstrates a commitment to both innovation and regulatory compliance, minimizing the risk of breaches and ensuring patient trust. Incorrect approaches analysis. One incorrect approach involves immediately applying predictive modeling techniques to raw patient data without adequate de-identification or consent. This directly violates HIPAA privacy rule, which mandates protections for PHI. The risk of unauthorized access, use, or disclosure of PHI is extremely high, leading to significant legal penalties and reputational damage. Another incorrect approach is to solely rely on anonymization without considering the potential for re-identification, especially when combining datasets. HIPAA de-identification standards are specific, and simply removing direct identifiers may not be sufficient if indirect identifiers can be used to re-identify individuals. This approach fails to meet the regulatory threshold for de-identification and exposes the organization to compliance risks. A third incorrect approach is to proceed with data mining and predictive analytics without a clear data governance policy or documented risk assessment. This demonstrates a lack of due diligence and a failure to proactively identify and mitigate potential privacy and security risks. Without a structured framework, it is difficult to ensure that data is being used ethically and in compliance with all applicable regulations. Professional reasoning. Professionals in this field must adopt a risk-based approach. This involves 1. Understanding the specific regulatory landscape, HIPAA in this case, and its requirements for data handling and privacy. 2. Conducting thorough risk assessments to identify potential vulnerabilities and threats to PHI. 3. Implementing appropriate technical and administrative safeguards, including de-identification techniques, access controls, and data encryption. 4. Establishing clear data governance policies and procedures that outline the acceptable uses of health data. 5. Seeking legal and ethical counsel when in doubt about data usage or de-identification methods. 6. Prioritizing patient privacy and data security in all analytical endeavors, ensuring that the pursuit of insights does not compromise individual rights. Question 17. Comparative studies suggest that a new surgical technique for treating a chronic condition may offer improved patient outcomes compared to the standard procedure, but at a higher initial cost. A health data analyst is tasked with evaluating which approach represents the best use of limited healthcare resources, considering the potential for differing impacts on both the duration and quality of life for patients. Which economic evaluation method is most appropriate for informing this resource allocation decision, ensuring alignment with U.S. healthcare policy objectives for maximizing population health value? Option A, cost minimization analysis. Option B, cost-effectiveness analysis focusing solely on clinical event reduction. Option C, cost-utility analysis. Option D, a simple comparison of total program costs without outcome adjustment. The correct answer is C, cost-utility analysis. Explanation: scenario analysis. This scenario presents a common challenge in healthcare economics where resource allocation decisions must be made based on evidence of effectiveness and efficiency. The core difficulty lies in comparing interventions that may have different outcomes and cost structures, requiring a robust analytical framework to ensure that the chosen intervention provides the greatest health benefit for the resources invested. The Certified Health Data Analyst, CHDA, must navigate the complexities of economic evaluation methods while adhering to the regulatory and ethical standards governing health data analysis in the U.S. Correct approach analysis. The correct approach involves utilizing cost-utility analysis, CUA. CUA is best professional practice in this context because it measures health outcomes in terms of quality-adjusted life years, QALY, which accounts for both the quantity and quality of life gained. This standardized metric allows for the comparison of diverse interventions across different disease areas, aligning with the U.S. regulatory emphasis on evidence-based decision-making and efficient resource allocation within healthcare systems. By using QALY, CUA provides a comprehensive measure of value that is crucial for informing policy and clinical practice, ensuring that investments maximize population health. Incorrect approach is analysis. Choosing cost minimization analysis, CMA, would be an incorrect approach because it assumes that the interventions being compared produce equivalent outcomes. If the interventions have different effectiveness profiles, CMA would lead to a flawed conclusion by only focusing on the lowest cost without considering the health benefits. This failure to account for differential outcomes is a significant ethical and regulatory concern, as it could result in the selection of a less effective intervention, potentially harming patient health and misallocating resources, which violates principles of evidence-based practice and responsible stewardship of healthcare funds. Selecting an approach that solely focuses on cost-effectiveness without considering the quality of life impact would also be incorrect. While cost-effectiveness analysis, C, is a valid economic evaluation method, it measures outcomes in natural units, e.g., lives saved, cases cured, which can be difficult to compare across different types of interventions. In a situation where the goal is to compare interventions with potentially different impacts on patient well-being and longevity, a method that standardizes outcomes to a common metric like CALI, as in CUA, is superior for comprehensive decision-making. Relying on a less comprehensive method could lead to suboptimal resource allocation and fail to meet the implicit ethical obligation to maximize overall health gains for the population. Professional reasoning. When faced with comparing healthcare interventions for resource allocation, a CHDA should first identify the objective of the comparison and the nature of the outcomes. If interventions are expected to yield different health outcomes, and a comprehensive measure of value that incorporates both length and quality of life is desired, cost-utility analysis is the most appropriate method. This aligns with the U.S. regulatory environment that increasingly demands robust evidence of value and effectiveness. The decision-making process should involve a thorough review of available evidence on comparative effectiveness and costs, followed by the selection of the economic evaluation method that best captures the relevant dimensions of value for the decision at hand. Transparency in methodology and assumptions is also critical for ethical and regulatory compliance. Question 18. Assessment of a health data analyst's decision to deploy a random forest model for predicting patient readmission risk, when the clinical team has expressed a strong need for understanding the specific factors contributing to each individual patient's risk score, is ethically and regulatorily challenging. The analyst is aware that, while random forests can offer high predictive accuracy, their inherent complexity can make it difficult to provide a clear, step-by-step explanation of how a particular risk score was derived. Considering U.S. healthcare regulations and ethical best practices for health data analysis, which approach best balances predictive power with the imperative for transparency and accountability. Option A. Deploy the random forest model and implement post-hoc explanation techniques, e.g., SHAP, LIME, to provide insights into the feature importance and contributions for individual predictions, thereby bridging the gap between model complexity and the need for transparency. Option B. Prioritize interpretability by selecting a simpler classification algorithm, such as a single decision tree, that allows for clear visualization and explanation of the decision-making process, even if it means a potential decrease in predictive accuracy. Option C. Deploy the random forest model and provide a general overview of its predictive capabilities, emphasizing its accuracy without delving into individual prediction explanations, as the complexity of the model makes detailed explanations impractical and potentially misleading. Option D. Deploy the random forest model and rely on the clinical team's expertise to interpret the risk scores, assuming they can infer the underlying reasons for the predictions based on their clinical experience. The correct answer is C. Deploy the random forest model and provide a general overview of its predictive capabilities, emphasizing its accuracy without delving into individual prediction explanations, as the complexity of the model makes detailed explanations impractical and potentially misleading. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves balancing the potential benefits of advanced analytical techniques with the ethical imperative to ensure patient privacy and data security. The health data analyst must navigate the complexities of using a random forest model, which can be a black box to some extent, while adhering to strict U.S. regulatory frameworks like HIPAA. The inherent trade-off between model complexity and interpretability, especially when dealing with sensitive health information, requires careful judgment. Correct approach analysis. The correct approach prioritizes transparency and explainability, aligning with the spirit and letter of U.S. healthcare regulations, particularly HIPAA privacy rule and security rule. While random forests can offer superior predictive accuracy, their ensemble nature can make it difficult to pinpoint the exact reasoning behind a specific prediction. Therefore, when a clear explanation of the decision-making process is critical for patient care, regulatory compliance, or audit purposes, opting for a more interpretable model like a decision tree, or employing techniques to explain the random forest output, e.g., SHAP values LIME, is best professional practice. This ensures that the data analyst can justify the model's recommendations, identify potential biases, and maintain accountability, all of which are fundamental to ethical data handling in healthcare. Incorrect approaches analysis. Choosing a random forest solely for its perceived superior accuracy without considering interpretability fails to adequately address the ethical and regulatory requirements for explainability in healthcare. This approach risks violating HIPAA by creating a system where decisions impacting patient care cannot be readily understood or audited, potentially leading to patient harm or discriminatory outcomes that are difficult to detect. Implementing a decision tree without considering the potential for overfitting or the need for ensemble methods to improve robustness overlooks the practical limitations of simpler models. While interpretable, a poorly constructed decision tree might lead to inaccurate predictions, which in a healthcare context can have serious consequences for patient diagnosis and treatment, thereby failing the duty of care. Using a random forest and then dismissing any need for further explanation because the model is complex is a direct abdication of professional responsibility. This approach ignores the ethical obligation to understand and validate the tools used in patient care and the regulatory requirement under HIPAA to ensure data is handled securely and appropriately, which includes understanding how it is being used to generate insights. Professional reasoning. Professionals should adopt a decision-making framework that begins with understanding the specific use case and its implications. This involves identifying the critical requirements for the analytical output, such as the need for interpretability, accuracy, and compliance with regulations like HIPAA. When faced with a choice between models, the analyst should weigh the trade-offs, considering not just performance metrics, but also the ability to explain the model's reasoning, audit its decisions, and ensure patient safety and privacy. If a more complex, less interpretable model is chosen for its performance benefits, robust methods for explaining its outputs must be employed to meet ethical and regulatory standards. Question 19. When evaluating patient readmission data for a hospital quality improvement committee, which approach to communicating the key findings would best facilitate understanding and actionable decision-making among diverse stakeholders, including clinicians and administrators? Option A. A comprehensive, multidimensional scatterplot displaying all raw data points and statistical correlations without additional explanatory text. Option B. Clear bar chart illustrating readmission rates by diagnosis group, accompanied by a concise narrative highlighting the highest risk areas and potential contributing factors. Option C. A detailed, unsummarized data table listing every patient readmission event with all associated demographic and clinical variables. Option D. A pie chart showing the proportion of readmissions for each of the 20 most common diagnosis groups. The correct answer is B. A clear bar chart illustrating readmission rates by diagnosis group, accompanied by a concise narrative highlighting the highest risk areas and potential contributing factors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a health data analyst to translate complex analytical findings into actionable insights for a diverse group of stakeholders, each with varying levels of data literacy and specific interests. The challenge lies in ensuring the chosen visual representation is not only accurate, but also comprehensible, persuasive, and ethically sound, avoiding misinterpretation that could lead to poor decision-making or regulatory noncompliance. The analyst must balance the need for detail with the imperative of clarity, all while adhering to the strict data privacy and security regulations governing health data. Correct approach analysis. The correct approach involves selecting a visual that clearly and accurately depicts the key trends and outliers in the patient readmission data, accompanied by a concise narrative that explains the implications of these findings. This aligns with the Certified Health Data Analyst (CHDA) exam's emphasis on effective communication of insights. Specifically, using a well-designed bar chart to show readmission rates by diagnosis group, alongside a clear explanation of the highest risk groups and potential contributing factors, directly addresses the stakeholders' need for understandable information. This approach prioritizes data integrity and ethical communication by presenting findings transparently and without oversimplification or misleading emphasis, thereby supporting informed decision-making and adherence to principles of responsible data use as implicitly guided by health data regulation. Incorrect approaches analysis, presenting raw, unsummarized data tables without any visual aids or narrative explanation, fails to meet the communication objective. This approach is professionally unacceptable because it burdens stakeholders with the task of interpreting complex data, increasing the likelihood of misinterpretation and inaction. It also fails to demonstrate the analyst's value in synthesizing information. Using a highly complex, multidimensional scatterplot with numerous data points and statistical overlays, without a clear explanation of its interpretation, is also professionally flawed. Potentially rich in detail, it can overwhelm non-technical stakeholders, rendering the insights inaccessible and leading to confusion rather than clarity. This can indirectly lead to poor decisions, which could have downstream regulatory implications if patient care is negatively impacted. Employing a pie chart to represent readmission rates across numerous diagnosis groups is an ineffective visual choice. Pie charts are best suited for showing proportions of a whole when there are very few categories. With many diagnosis groups, a pie chart becomes cluttered and difficult to compare segments accurately, hindering comprehension and potentially obscuring critical insights about specific high-risk areas. This lack of clarity can lead to a failure to identify and address significant patient safety issues, which is a core ethical and regulatory concern in healthcare. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the audience and the purpose of the communication. The analyst must identify the key message to be conveyed and the desired outcome. Next, they should consider the nature of the data and the insights derived. The selection of a visualization tool should then be guided by its ability to accurately and clearly represent these insights to the intended audience, prioritizing clarity and interpretability over complexity. Finally, the analyst must ensure that the communication adheres to all relevant ethical guidelines and regulatory requirements concerning data privacy, security, and the responsible use of health information, ensuring that insights are presented in a manner that promotes patient well-being and organizational accountability. Question 20. Market research demonstrates a growing demand for analyzing patient demographic and treatment outcome data to identify trends in chronic disease management. A healthcare organization has a large dataset containing patient information, including names, addresses, dates of birth, medical record numbers, and specific diagnoses and treatment details. To facilitate this analysis, the organization needs to de-identify this data. Which of the following approaches best aligns with U.S. federal regulatory frameworks for health data privacy and analysis? Option A. Apply a standard set of de-identification techniques, such as masking dates and zip codes, without further expert review or statistical validation, and proceed with analysis. Option B. Remove all direct identifiers such as patient names, addresses, and medical record numbers, and then share the dataset with external researchers for analysis. Option C. Engage a qualified statistician to apply statistical methods to the dataset to reduce the risk of re-identification to a very small level, ensuring compliance with the expert determination method for de-identification. Option D. Share the raw, unde-identified dataset with a research partner under a verbal agreement to ensure data confidentiality, as the research is for public health improvement. The correct answer is C. Engage a qualified statistician to apply statistical methods to the dataset to reduce the risk of re-identification to a very small level, ensuring compliance with the expert determination method for de-identification. Explanation. This scenario presents a common challenge in health data analytics, balancing the need for robust data analysis to improve patient care with the stringent privacy requirements mandated by U.S. federal law, specifically the Health Insurance Portability and Accountability Act, HIPAA. The professional challenge lies in identifying and applying appropriate de-identification methods that render data unusable for re-identification, while still preserving its analytical value. The core of the problem is understanding the nuances of HIPAA privacy rule regarding protected health information, FI, and the Safe Harbor vs. Expert determination methods for de-identification. The correct approach represents best professional practice because it directly adheres to HIPAA de-identification standards. By engaging a qualified statistician or other expert to apply statistical methods to de-identify the PHI, the organization is following the expert determination method outlined in the HIPAA privacy rule. This method ensures that the risk of re-identification is very small, thereby protecting patient privacy while allowing for the use of the data for research and quality improvement. This approach demonstrates a commitment to regulatory compliance and ethical data handling, which is paramount in the healthcare industry. An incorrect approach that involves simply removing direct identifiers like names and addresses without further statistical analysis or expert review fails to meet HIPAA requirements. This is because indirect identifiers, when combined, can still lead to re-identification. This approach would constitute a regulatory failure under HIPAA, as it does not adequately protect PHI. Another incorrect approach, such as using only a limited set of common de-identification techniques without expert validation, also risks re-identification and violates the spirit and letter of HIPAA. This would be an ethical failure due to the potential breach of patient confidentiality. A third incorrect approach, which involves sharing the data with external researchers without a business associate agreement (BA) and without proper de-identification, is a severe regulatory and ethical violation, exposing the organization to significant penalties and reputational damage. Professionals should approach such situations by first understanding the specific data elements that constitute PHI under HIPAA. They must then consult the HIPAA privacy rules de-identification provisions, specifically the safe harbor method, which involves removing 18 specific identifiers, and the expert determination method. When the safe harbor method is not feasible or sufficient, the expert determination method, involving a qualified expert, is the appropriate path. This decision-making process requires a thorough risk assessment, consultation with legal and compliance experts, and a clear understanding of the intended use of the data.